Hey everyone, welcome back to the Physio Guy podcast, your go to show where we simplify physiotherapy and talk about your body and how it really works. I am Anand, and today's topic is something every physiotherapist deal with almost daily, that is muscle imbalance. You have probably seen people with one shoulder higher than the other, one leg shorter, or rounded back posture. These are all result of muscle imbalance. In this episode, we will understand what muscle imbalance is, why it happens, and what problems it causes, and of course, how to fix it through physiotherapy and exercises. So, in our first segment, we are going to talk about what is muscle imbalance. So let's start with the basics. A muscle imbalance happens when certain muscles become stronger, tighter, or overactive while the other opposite muscles become weaker or underactive. For example, if your chest muscle that are pectorals are tight and your upper back muscle that is rhomboid and trapezius are weak, you should start to roll forward, causing the rounded shoulder posture. Or if your quadriceps overpower your hamstring, it can lead to knee pain or even increase your risk of injury. In simple terms, your body works in muscle pairs, one pulls, other stabilize. When their partnership breaks, your movement become ineffective and joints start taking the stress. Why imbalance happens? You will have this question a lot, that why it happens. So, what causes this imbalance? Let's go through most common reasons. First is sedentary lifestyle. Sitting for long hours tightens your hip flexors and weakens your glutes. Over time, your pelvic tilts forward, sometimes we can call it anterior pelvic tilt, leading to lower back pain. Second, repetitive movements. Doing the same activity like typing, driving, or lifting trains certain muscles repeatedly, leaves the opposite muscles neglected. Then the third thing is poor posture. Slouching or forward head posture continuously stretch some muscles and tightens other, disturbing muscle harmony. If you want to know more about postures, you can watch our last podcast. There I have explained what posture is and how to correct it. Now we are going to talk about the fourth thing, that is unbalanced workout. Many gym goers train front muscles more, chest, bicep, abs, and forgot about the backs and glutes. The mirror muscles culture is one of the biggest reason for the imbalance. Fifth and foremost reason is injury and compensation. After the injury, your body automatically compensate. For example, if you hurt on right leg, you start overusing your left. This unevens the load distribution and persists even after recovery, causing chronic imbalance that you can see in ACL tear. Now we will talk about effects of the muscle imbalance. Let's talk why this is a big deal. Muscle imbalance doesn't change how you look, it affects how your body functions. Joint stress. When muscles pull unevenly, joint moves out of their natural alignment, causing the pain and wear and tear. Then reduce mobility. Tight muscles limit flexibility and range of motion. Chronic pain. Back pain, neck stiffness, knee pain often have imbalance as their underlying causes. Poor posture. Imbalance discomfort your posture. Round shoulders, pelvic tilt, and uneven gait are common results. Injury risk. Weak stabilizing muscles can't protect your joint during activity, increasing the risk of sprain and strain. How to fix muscle imbalance? The good news, muscle imbalance can be corrected with consistent targeted physiotherapy and exercises. Here are the process I recommend. Assessment. Start with the posture and movement analysis. Physiotherapists use visual observation, strength testing, and flexibility to check, identify overactive and underactive muscles. Release the tight muscles. Use technique like stretching, foam rolling, or myofascial release to overactive muscles. Example, stretch the hip flexors if the pelvic tilt forward. Activate weak muscles. Perform low load activation exercises for weak innervated muscles. Example, strengthen the glute and core to balance hip alignment. Retrain the movement pattern. Practice correct movement habit during sitting, walking, or lifting. Physiotherapy exercises like bridging, scapular traction, plank, and rows help restore symmetry. Ergonomic lifestyle changes. Set up your workstation to promote good posture. Take short breaks from sitting. Train both sides of your body equally during workouts. Let's give you a real life world example that I went through. A patient of mine once came with chronic shoulder pain. He was a regular gym goer who focused heavily on bench press and push ups but never trained his back. His chest muscles were extremely tight while his upper back were weak. After assessing him, we focused on stretching his pectoralis, strengthening his mid back, and improving his scapular stability. Within weeks, not only did he reduce pain, but his posture improved, his workout becomes more balanced. Now, we will talk about the key takeaways from this podcast. Remember, the human body is all about balance. When one muscle overworks, other one suffers. By understanding this relationship and correcting small imbalance early, you can prevent major injuries later. Think it like don't work hard, work balanced. That's all for today's episode of Future Guy podcast. If you found it this helpful, share this with your gym buddies or anyone struggling with postures or body pain. And don't forget to subscribe to the Physio Guy podcast on YouTube and follow for more episodes where we simplify physiotherapy and body mechanism in an easy language. Until next time, stay strong, stay aligned, and keep moving right. Thanks for watching. Take care. Bye bye.